Hello, welcome to another one of my review videos. In this video I'll be tackling some of the subjects regarding the study of blood, and that's of course as it pertains to the medical assistant. So this PowerPoint titled Medical Assisting Hematology. Let's jump in. So a little bit of an introductory statement here. Hematology just means the study of blood. If you break the word down, hemato is the combining form talking about blood. The suffix of ology means the study of something, so we think of hematology as the study of blood. If you want to know what's going on in the blood system, what's it composed of, how much of each thing, you really want to look at one of my previous videos where I talk about the blood system itself. This video, we're really discussing the tests that are performed. So the study of blood. This includes morphological appearance of blood cells. Morphology, of course, is the study of shape and structure. Function of the blood cells, and diseases of the blood and blood-forming tissues. Some of the tests that we can perform are as follows. We can perform hemoglobin tests. That's a test to get a quantitative level of the number of hemoglobins in your bloodstream. Those are, of course, the molecule responsible for carrying and transporting oxygen around the body, and those reside in our red blood cells. Hematocrit is a test on packed blood cells. We'll look at that in a little bit. And white blood cells. White blood cells, of course, are responsible for our immune response, and we can do white blood cell counts. Other more specific hematology tests, red blood cell counts, an RBC count. Differential white blood cell counts, they're able to tell you the 5 different types of white blood cells and the levels of each. Erythrocyte sedimentation rate, and platelet count. The most important ones we're going to try to tackle here first, starting with a CBC, complete blood count. It's an extremely common test. It's one of the most common blood tests ordered, along with other ones like a metabolic panel that looks at the serum. This one specifically looks at the red cells in our blood system, and it's frequently performed. It's the most frequently performed hematological test, and it's performed typically on new patients as part of a standard panel, or patients with pathologies. If we're worried about something like polycythemia, extra cells, or if we're worried about anemia, a lack of cells, we can get a blood count, quick and easy. It requires a venipuncture and a removal of a venous blood specimen into a tube that can preserve the blood and keep it from clotting. Tests included in this complete blood count would be a white blood cell count, a red blood cell count, platelet counts, hemoglobin levels, hematocrit, differential white blood cell, and red blood cell indices. Hemoglobin determination. Hemoglobin is a huge component of red blood cells. It's like what red blood cells are. The majority of them is hemoglobin. Hemoglobin is a small molecule containing a protein containing 4 iron atoms in each hemoglobin molecule. Those iron atoms are able to hang on to oxygen temporarily, and that's how our red blood cells transport this gas around our body. In every red cell, you have, roughly speaking, in the hundreds of millions, the number that I'm familiar with is 250 million hemoglobin molecules in every red cell. Hemoglobin transports oxygen to the tissue cells by creating iron oxide with the iron and bonding to oxygen, and it's responsible for that reddish color that we see our blood having. The reference range, this is a reference range for people that haven't heard this before. A reference range is the normal range for any laboratory test or any objective measurement. You always want to have a reference range to refer back to. For the female, we expect reference range of roughly 12 to 16 grams of hemoglobin per deciliter of blood. A gram, for reference, is roughly the weight of a paperclip, and a deciliter is 1/10 of a liter. So picture a liter container, 1/10 of that is a deciliter. The adult male between 14 and 18 grams per deciliter. Hemoglobin can be performed as an individual test or part of a complete blood count. Decrease in hemoglobin levels. This is going to occur with anemia. The most common type of anemia is iron deficient anemia. You can think of anemia as either a lowered count of red cells because of something like a hemolytic disease or something like just failure to produce red cells, or a low levels of hemoglobin. So you have the red cells but not enough hemoglobin in them. Either way, anemia is a deficiency in the red cells, and iron deficient anemia is the most common one. Hyperthyroidism will cause decreases in hemoglobin, overactive thyroid, cirrhosis of the liver, severe hemorrhaging, bleeding, internal or external, hemolytic reactions. Hemolysis, of course, is the breakdown of blood, and certain systemic diseases like leukemia or Hodgkin's disease. An increase in hemoglobin levels, polycythemia, extra cells, COPD, chronic obstructive pulmonary disease, or CHF, congestive heart failure. The next test is hematocrit. Abbreviation is capital H, lowercase c, lowercase t. The word hematocrit means to separate blood, to separate the solid cellular elements, separate those from the plasma. The way you do this is by taking a sample of blood and centrifuging it. Because of the different weight relative of each of the cells versus plasma, in a centrifuge, the cells will move towards the outside, the tail end of the tube, and the plasma will sit on top of that, and you can thereby separate the red cells from the plasma. Heavier red blood cells become packed and settle to the bottom of the tube. The top layer of the tube would contain clear, straw-colored plasma. Plasma is going to be mostly water, more than 90% water, and other dissolved substances. Think salts, hormones, sugars, other waste products. That's in the plasma. Between the layers, you have what's called a buffy coat. It's basically just platelets and white cells. It's heavier than the plasma, but lighter than the red cells, so it forms its own layer. We call it the buffy coat. Very thin. The bottom layer is going to be all packed red blood cells. Okay? And with the hematocrit, you measure how much of the sample is packed red blood cells. So when they show you a reference range of 37 to 47 for women and men 40 to 54%, they're saying how much of that total blood sample is red cells. Okay, so when you pack it down, measure it, how much of that sample is red cells. The reference range for women is lower than the reference range for men, and that's okay, it's normal. Men between 40 and 54%, women between 37 and 47%. There's obviously some overlap there. Low readings, we worry about anemia. High readings, we worry about polycythemia or other associated diseases. And it can be used along with other tests to diagnose the patient's condition. There's another method called microhematocrit, in which the blood is in which capillary blood rather than venous blood is drawn into a very small, thin tube. It's essentially a very similar concept. They're packing the blood down and getting a measurement of a percentage. They use a disposable capillary tube with blood obtained from capillaries by skin puncture, and then the tube is sealed on an end. And the tube is then centrifuged for several minutes, which packs the red blood cells. You read you essentially read it like a thermometer, like a meter, how high up the red blood cells are on that packed tube as a percentage. The next measurement is a white blood cell count. It's an approximate measurement of the number of white cells in circulating blood, and the reference range. 4,500 to 11,000 white blood cells per cubic millimeter of blood, expressed on laboratory reports as 4.5 to 11.0 times 10 to the third millimeters per cubic millimeter. This is scientific notation. When you see 10 to the 3, you think I'm going to shift that decimal point 3 spaces to the right if the exponent of 3 is positive, and to the left if the exponent is negative. So you would read 4.5 times 10 to the third per millimeters cubed is the same reading as 4,500 white blood cells per millimeters cubed. It's just a way to write big numbers small. Leukocytosis would be a condition that would generate an increased number of white blood cells. We think about increase in white cells during systemic infections, appendicitis, chickenpox, diphtheria, mononucleosis, meningitis, rheumatic fever. All of these affect the body, and they're going to cause an immune response from the body, and so an increase in white cells. Normally, during pregnancy, they can raise strenuous exercise, stress, or treatment with corticosteroids. Leukopenia. It's a decrease in white blood cells. Penia means a decreased level of something. Viral infections, chemotherapy, radiation therapy. So, treatments, therapies that would suppress the immune system. We worry about decreases in white cells. Red cell counts. Measurement of the number of red blood cells in whole blood. Notice, if you recall, there was in the thousands of white cells per cubic millimeter. Red cells, there's going to be in the millions of them per cubic millimeter. So for women, 4 to 5.5 million per cubic millimeter. That would be 4 to 5.5 times 10 to the 6 per cubic millimeter. Men, 4.5 to 6.2 times 10 to the 6 blood red cells per cubic millimeter. And of course, on lab reports, they do express that in scientific notation. So definitely get used to scientific notation. Again, it's a way we can write big numbers in a small way. The test can be done using a blood cell counter. So again, you can do just a red cell count, and a decrease in red cell count would come from anemia, Hodgkin's disease, these are systemic things, or leukemia, cancer, a blood cancer. An increase in red count comes from things like polycythemia, extra production of red cells, or because you have a concentration of blood because of something like dehydration. I should pause here to mention that there are some things that can be done during venipuncture that if you do them incorrectly, you can cause an artificial increase in red cell count because you concentrate the blood. Specifically, that comes when you leave the tourniquet on during a venipuncture for longer than a minute. It causes the blood to, the pressure inside the vein to cause fluid to leak from the vein into the extravascular space, the space around the vessel, and thereby leaving what's in the vessel to be more concentrated than it otherwise would be. That would cause a false increase in all of the blood counts. So it would cause a false increase in white cells, cause a false increase in platelets, and cause a false increase in red cells. It looks on the lab report like dehydration when all you did was leave the tourniquet on for too long. So definitely something to keep an eye on. You don't want to be altering lab results artificially because you made some goofy mistake. And lastly, pulmonary fibrosis. It's a lung disease. Okay, I hope you enjoyed this quick review video. Please check back for subsequent videos. Thank you.